Global markets were roiled Friday after U.S. President Donald Trump announced that he and the First Lady have tested positive for the coronavirus. The president's physician, Sean P. Conley, released a statement earlier saying that Trump and his wife are both well at this time and they plan to remain at home within the White House during their convalescence. To unpack the latest on this, Sophie Mukwena, SABC foreign editor, Nick Harper, SABC correspondent in Washington, Siobhan Bryce, a piece, our correspondent at the UN, and Professor Buli Makula, who is the head of the Department of Internal Medicine at the University of KwaZulu-Natal. But first, let me start with my colleague Nick. So Nick, what is the latest from the White House? I'd imagine a flurry of activity and reactions.
Certainly, yeah, it's been a busy day, very fast-moving news story, this one. But I think the White House is really trying to reassure the American people that the president is not incapacitated, that he's in good health, and that he's continuing to run the country. A short while ago, the White House Chief of Staff, Mark Meadows, came out and talked to reporters. He said that the president was in good spirits, that he was very energetic, despite the fact that he was showing mild symptoms. He also said that the president will remain on the job. And we've also got a flurry of activity in Washington, D.C., with other politicians and their aides rushing to get tested, especially the ones that have been within the White House or within close contact of the president within the last week or so, all of them trying to see if they have tested positive. But at this stage, the White House is saying that the president is in good health despite that positive result, and he's continuing to work for the country.
And the news of Joe Biden having tested negative, what was the reception thereof, given the fact they were in a presidential debate together? And as much as he was expected to enter the debate hall with a mask and interact with President Trump with one, it wasn't so.
That's right, yes. The president had a mask in his pocket during the debate. He even pulled it out at one point to show that he was carrying it. But he did say that he didn't like wearing it, unlike Joe Biden, who he said was always wearing a mask. Now, Joe Biden has sent his well wishes to President Trump, wishing him a swift recovery. But it will, of course, be a relief to the Democrats seeing Joe Biden not contracting COVID-19, because the two men spent a good 90 minutes in that debate hall. They were separated by a distance of more than 2 meters, but it was a very long time for both men to be in the same room together. So there was certainly some nervousness in those period of several hours between the president's positive test result and Joe Biden's negative one. Some fear within the Democrat camp that they could also see Joe Biden with a similar result. But at this stage, the Democrats are really trying to push ahead. Joe Biden is out campaigning today. He'll be speaking in Michigan, the state there, in just a few hours' time. We're expecting him to continue to push that message of keeping socially distanced, to continue to wear a mask as he himself has done, leading by example, and really showing that what he thinks of the president and his actions of not wearing a mask and not socially distancing by holding those big rallies has essentially led to him contracting COVID-19.
All right, to New York now, the seat of the New York Stock Exchange. Sharon Bryce, piece I mentioned earlier on, global markets reacting to this. Nick earlier on talking about the contact tracing, which is of course very important because Hope Hicks, the advisor to the president, also tested positive. How wide is this net being cast?
Right. I mean, you literally have to trace where this president, Sepiso, has been in the last number of days. There was a debate in Cleveland, Ohio on Tuesday. Of course, great concern within the Biden camp as to, if they got too close. But there was social distancing. And we can, of course, now confirm that both Joe Biden and Jill Biden tested negative after testing as a result of the developments here in the United States. But yeah, there are so many people that are involved here, staff that work within the White House. We know that they test when you start your day at the White House, but there's no clarity on whether they wear masks within the White House, whether they're in close proximity to the president or not. Hope Hicks and a number of staff accompany the president when he travels to campaign stops, when he went to that debate, when he went to a fundraiser in New Jersey yesterday, and they generally do not wear masks on board. And remember, air on these aircraft, whether you're in Marine One or whether you're on Air Force One, this is recycled circulatory air that that everybody's breathing, particularly if they're not wearing masks. So in terms of contact tracing, and I'm no epidemiologist, but there is a vast number of people that these aides, including the president, Hope Hicks, and a number of aides have come into contact with. So whether, we're getting news that Mike Pence and his wife have now tested negative, but the test only gives you a snapshot at what's going on in your body at this very moment. What happens after that test is the big question, right? You don't know whether he's been infected or not just because the test is negative. That test could come back positive if he were to do one later this evening or tomorrow morning. So the concern here is how deep this goes, how widespread it is, and that's the answer we don't have right now, Tsipiso.
And of course, Sherwin, you've got some notes to share with us about the contact tracing. That is something that you mentioned earlier on. There was a list of people, but I want to talk about, you mentioned the Chief of Staff earlier on, the Meadows White House. Talk to us about that.
Yeah, so Mark Meadows came out earlier today to talk to a gaggle of the press, really to sort of allay fears, if you will, talking, as Nick Harper pointed out, that the president is in good spirits, is in high energy, he's still going to continue working. He spoke to that gaggle of reporters. Do we have that tape? Can we play it?
All right, Sherwin, we'll see if we can get to that later on. Professor Makula, taking into consideration President Donald Trump's advanced age, could his convalescence take longer?
So, in general, people of an older age, meaning those above the age of 60, and those also that have other underlying diseases, whether it is hypertension, diabetes, they generally are at risk of developing more severe form of disease. But from what we're hearing, his symptoms are mild. So, he may actually fall within that category of individuals who, despite, the older age, might still have milder disease. That is also possible. But in general, older people are at risk of acquiring more severe form of disease.
And just in terms of this, whether or not it was a long time coming, President Donald Trump, very famous for his views on mask wearing. You heard our correspondent Nick Harper speak about the fact that he's very much uncomfortable with it. Was this inevitable, basically?
So we know what needs to be done to prevent acquisition of COVID-19. And I think the message has been out, and it's been proven that the best way of dealing with this infection is actually prevention, and the preventative measures are known. So I think without adhering or using any of the prevention measures, it is possible that one can say that the likelihood of acquiring the infection is actually quite high.
All right. Foreign editor Sophie Mukwena with us in this discussion as well. Sophie, the markets reacted. World leaders sent in their well wishes. Is this the biggest COVID-19 news story of the year in relation to this?
I don't think it can match when the announcement was made and COVID-19 was declared a pandemic. But of course, the United States of America is the biggest economy around the world, and therefore you expect the market to react the way they reacted. But secondly, we know that President Trump has been in denial in terms of the impact of COVID-19 in his own country, but around the world. And he chose to accuse China of not really coming forward with information which led to his country having this problem. But other people are arguing that he could have done something as early as possible to ensure that he is able to bring the numbers down. I mean, even this week when he was with Joe Biden during that debate, my concern when they came in, I saw them coming in. I was expecting Donald Trump not to wear the mask, but I was expecting expecting Joe Biden to have a mask and remove a mask when he starts speaking. Unfortunately, he didn't do that because billions were watching around the world. And I thought the Democrats will take that opportunity to demonstrate that they mean business in terms of fighting COVID-19. But also the reaction from the WHO today, both Dr. Tedros and Dr. Mike Ryan talking about the incident, particularly after journalists posed questions in terms of whether Donald Trump was responsible in terms of leading the country in a proper direction to ensure that the numbers are not as huge as they are currently. And let's take a listen at what Dr. Mike Ryan and Dr. Tedros said at the briefing today in Geneva, the WHO. Let's take a listen.
We wish the President and his partner well, like we would wish anyone facing this disease well. This is a nasty virus, and this virus can cause severe disease, particularly in older individuals with underlying conditions. So we wish the President and his partner well in this process, and anyone else who's affected within that cluster. Disease can be transformative. We've all been through things in our lives, health events that transform our lives whether we want them to or not, and therefore and other things that allow us to learn and absorb lessons from our lives. We want everyone possible in the world. We want all public leaders, particularly leaders of great countries, to lead us and to give us hope, to give us certainty, to give us truth, and to give us a chance to fight and win against this disease. So it is never, ever, ever too late for that to be true. And therefore I hope that all leaders around the world in health, in medicine, in politics reflect upon what we're all facing, and that we can all come together to fight this disease, and particularly to be very practical, to each government to invest enough in its community, in its surveillance, in its clinical care, so we can bear the burden of the disease for now and push the disease to the lowest possible level. But as well, and I say this quite clearly, there is a solution potentially coming down the line. There is huge innovation developing the vaccines, the therapeutics and the diagnostics that we need. There is a barrier between us and that achievement. And it is a relatively small amount of money when we think about what has been spent and what has been drained from our collective pocketbooks from the global economy. These vaccines particularly don't offer an absolute final guarantee of getting this done, but they are a massively important tool, as they've proven themselves to be in the past. So I would say fine words are fine, and we need those words, but what we need now is action. What we need now is investment, and what we need now is solutions. And I hope everybody can reflect right now, as we send our best wishes to the President and his spouse, that we can redouble our efforts, find the right investments and get this job done.
Overnight, we heard that the President of the United States of America, Donald Trump, and First Lady Melania Trump tested positive for COVID-19. I want to start today by wishing them both a full and swift recovery. Our prayers are with them.
Well, of course, Tepiso, the big question is, as much as Donald Trump has tested positive right now, the question is he going to send a different message moving forward after 14 days? Secondly, you know that WHO has started a purpose vehicle to ensure that they are able to put funds to fight COVID-19, to come up with the vaccine. And America is non-committal in terms of putting money into this fund, but many countries have joined. The United Kingdom, you talk about Germany, you talk about China, particularly United Kingdom, because you know very well that at some point in time, Boris Johnson had to deal with this pandemic.
Okay. Let's bring in Professor Susan Kam from the University of New York into this discussion. A very warm welcome to you. What are your thoughts on these developments, and if they'll have any meaningful impact on how the U.S. election now unfolds?
Thanks for having me on. I'd like to say that it really depends on the way the disease progresses with President Trump and his wife, Melania. I think that the extent to which there's a various level of severity in which patients experience COVID, I think that there's different scenarios based on those outcomes for President Trump. So if it's a mild disease, I think that we might not see very much change in both President Trump's attitude towards the threat of the virus in general, as well as his political stance towards, for example, in New York State, we need billions of dollars in federal assistance because of the way that the COVID-19 crisis has decimated our local economies. And he hasn't been forthcoming, which doesn't exactly make sense because it's beneficial for a president running for re-election to have a decent economy. We don't want lots of people to be unemployed if you're running for president for re-election. So perhaps he will continue the course and perhaps have even less sympathy for states and other parts of the country and the electorate who are suffering or have suffered as a result of the pandemic. If he suffers or his wife suffers something a little more severe, we might see a little bit of a change of course. We may see that Trump will sort of use the framing of opening up the economy as a way for him to perhaps be a little more generous and a little more serious about tackling the economy. He could say, I want everything to be back to normal, so we're going to take these steps. So, for example, Trump has a lot more power to stop, movement of people, or to, encourage, or to basically tell states they have to do certain things, or the federal government can withhold resources. Like if you want funds, for example, for recovery, you have to put in these public health measures in place. That way, we won't have this unevenness in New York, in the United States, between states, in which some states want to take it very seriously. So in New York State, New Jersey, places like California, governors and state legislatures have taken very proactive stances, shutting down the economy, limiting it to non-essential businesses, passing mask ordinances. Whereas other places, my family lives in Georgia, we've had the opposite happen, in which the governor of Georgia at one point passed a statewide law saying that municipalities could not pass mask ordinances. So we could see a reversal if he had a difficult time and he survived. And I think that President Trump is he's very shrewd. He thinks a couple steps ahead. So I think that he wouldn't abandon his message of reopening the economy, but I think he would frame public health efforts as well as federal assistance to states and local governments in such a way.
Nick, in that vein, we saw Joe Biden issue an olive branch earlier on. What are the expectations? Is this going to be fuel for the fire? Because Trump's handling of COVID-19 has been very much a sore point, just in terms of the campaign that they've run, what they've wanted to highlight in his failings.
To tell what this will mean for voters. Remember that hundreds of thousands of people have already gone to the polls. They've already started voting. Donald Trump's name is on the ballot. So you have to wonder whether the people who haven't yet voted will perhaps, if they're undecided now, give Donald Trump a sympathy vote, or whether it will motivate Republicans to make sure that they do get out and support their president, essentially rallying around him. But I guess if that's the good news, the bad news is perhaps, like you mentioned, the fact that they've been trying for a very long time at the White House to really deflect attention away from the president's handling of the COVID-19 pandemic. With him testing positive, it very much puts that issue back in the spotlight. The Democrats will undoubtedly want to capitalize on that. And even though Joe Biden put out an olive branch, one of the senior Democrats, Speaker of the House, Nancy Pelosi, has effectively said in an interview, "I told you so," to the president. She said that by him holding rallies, by him choosing not to wear a mask, it had been a brazen invitation for something like this to happen. So, of course, there are divided opinions, and it's kind of unclear at this stage whether it will help or harm the president when it comes to the voters deciding whether or not to support him on November the 3rd's election.
So let's speak about those voters. Sharon Bryce-Pease, you've been getting various reactions from people. The president, I believe, was supposed to travel on the campaign trail to Florida. What has been the reaction now? Has this dented his credibility in terms of his wisdom, which we so often talks about on how to handle COVID-19?
I doubt it's hurt his credibility, certainly among his core supporters, right? That's a barometer that really doesn't move much, no matter what the president does. We are now hearing from the campaign that they will be moving to a more virtual format. So, of course, the president was expected to travel to Florida today. That, of course, cannot now happen because they are quarantining at the White House. He was supposed to go to Wisconsin. As you are hearing, both those states are pivotal battleground states that are absolutely essential to any network of states that he tries to combine so that he can win the Electoral College. Some of the reaction, I will just add to what Nick was saying. Nancy Pelosi in that interview was referring to, she said that this was a prayerful moment for the country. She also talked about how this maybe be a pivotal moment to take us to another place where science and not politics leads the way. And of course, this is a president that has politicized and in so doing muddied the waters in terms of the scientific response to this pandemic. The Joe Biden campaign also tweeting out this very action. Jill and I send our thoughts to the president and Melania and pray for swift recovery. We will continue to pray for health and safety of the president and his family. And of course, earlier today, we heard from New Yorkers. Remember, Trump is, before he moved down to Florida, officially his address, he was a New Yorker. This was his hometown. Let's listen to what some New Yorkers had to say, Tsepiso.
I think that it's going to put some fear into folks. If he does get out of this alive, God's willing, with health, I think he's going to continue with rhetoric as it's not, so bad. So that's something that does scare me. I don't want him to come out of it thinking that it really doesn't affect families, because it really is affecting folks. But again, I just hope for a speedy recovery. I do think it might be something that is going to have a negative effect on the stock markets.
It absolutely scares me, and what scares me even more is that he hosted a bunch of rallies telling his supporters that there was no virus to be scared of, and here he has it, a few weeks later, right? Just a few days ago at a debate, he was telling his supporters that there was nothing to be concerned about. He took all the precautions, but really, this is what we were scared of. And if our leader of our own country has it, I mean, it's still out there, and people have to be worried.
So it's really scary to think that now he has it, and so now he has to deal with it, and he has to think about all of those same remedies and same fake treatments that he's made up and has told people oh yeah, you can just deal with it this way, with injecting yourself with bleach and things like that. It's very disturbing.
Why didn't he listen to the scientists? That's what I continue asking. Why?
Well, those are the reactions from New Yorkers too. All right, as you say, showing reactions from New Yorkers. You mentioned earlier on the issue of science versus politics. Professor Makula, perhaps let me just come to you, and very briefly, if you could just tell us what has been the distinctions, and just looking at the global response from the various leaders, what has it been that they have elevated to the fore in order to say that the science of how we manage COVID-19 is actually more important?
I think it really highlights the importance of the rhetoric right from the beginning, the importance of wearing masks, of social distancing, and the taking this virus seriously, and highlighting the importance of prevention. And I think also what's coming out as important is the realization that, how this affects individuals might actually have an influence on the response. So with Donald Trump directly, how he will respond to it dependent on, the severity of disease that he experiences. And the other important factor also is that of compassion, and that it doesn't matter who it is that's affected. It's important to respond with compassion. And so we really wish him and his wife and family and everyone around him that may have been affected by this virus. We wish them all well, and highlight the importance of compassion and the importance of emphasizing the preventative aspect in the management of this infection. And while all the science around vaccine development and everything that's underway, we can still prevent this with the simple measures that we already know about at this stage.
So we're going to come to you in just a moment about how other global leaders have handled it. But Professor Kang, I want to come to you first, because I think this is something that has been foremost. What if President Donald Trump is incapacitated? Nick and Sherman spoke about it earlier on the statement by Nancy Pelosi, but please just take us through it, the legalities, the legislations, what the ramifications are.
Oh, well, constitutionally, if he's incapacitated, the next in command would be Vice President Pence. And I think that this is an interesting thing because every state controls laws about who's on a ballot. So it's very easy in New York State to get like the Republican person changed on the ballot, but what happens in other states, I'm not 100% sure because each state controls those kinds of laws. So there will be court battles to what extent, if he doesn't survive this and all these ballots have already come in, to what extent they'll be counted. And every state has their own laws and every municipality has their own practices as well. So it's going to be very complicated. And then after that, it's Nancy Pelosi. She's second in command if President Pence was not able to carry out his duties. And then that's an interesting dynamic because she is not from the same party as President Trump. And, after that, it is the president pro tempore of the Senate, who's Chuck Grassley, who is not somebody who has any kind of electoral, popular mandate in the same way that a Speaker of a House can sort of have this sort of indirect popular mandate as like a prime minister could. So that sort of creates a legitimacy issue if it goes all the way that far down. Of course, next is Secretary of the State, Mike Pompeo, who is appointed politically. So again, we have another political problem as well. And then Secretary Treasurer Stephen Mnuchin. So that's the way that the political line of succession goes. And we can see that it creates problems electorally. It creates problems in terms of political legitimacy. And then the question then becomes if President Trump does not survive, is not able to just to stand in for his duties or to be able to serve a second term as president, if he were to win anyway, their question would become what happens to that particular ticket? Who is, going to be able to govern?
So let's come to the issue of leadership. This is the leader of the first world, and as much as he's said what he had to say about how dangerous he thinks COVID-19 is there something that he could have learned from his counterparts from the less developed nations who haven't contracted COVID-19?
Yes, when you look at countries such as Germany, New Zealand, you have 2 women there. And this brings us to an argument whether women can really lead. And they have demonstrated that they gave leadership. I mean, you look at how Germany handled the whole crisis. It's doing very well. Yes, of course, Angela Merkel is a scientist, but also she was patient and she was able to listen to scientists and she was able to implement the recommendations of the World Health Organization, going to an extent of helping the neighbors in Europe. You also have New Zealand, the same with New Zealand. The numbers are very down. You look at the continent, I mean, Africa, when we were warned, we took stringent measures. I mean, leaders on the continent didn't hesitate to go to a very, very strong lockdowns. You look at South Africa, you look at countries such as Kenya, you look at countries such as Ethiopia, I mean, all the African countries. The African leaders have really demonstrated leadership by listening to scientists, by listening to the World Health Organization. I cannot forget South Africa in particular. You know, President Ramaphosa currently is the chair of the African Union. He's tasked with responsibility to pull countries during this crisis, the whole continent. And he led by example. The CDC was given capacity to handle this matter. And today everybody is asking a question, why Africa doesn't suffer the same fate like other countries. They forget that our leaders took very, very tough measures. They are wearing masks. They always remind us to always comply and do whatever World Health Organization is saying. And I think it is for that reason I agree with Dr. Mike Ryan, when he said perhaps the world can learn a thing or two from Africa. Unfortunately, with America, the trade war that had already started between America and China perhaps made President Trump
I want to end very quickly with our two correspondents in New York and in Washington. Very briefly from you both, what do you think we should be looking out for over the next week as a fallout from this story? And can we continue to see shaky ground on the markets? Nick, let's start with you. Nick, we'll start with you.
Well, certainly, I think what we're going to be looking to the White House for is reassurance. They've already tried to put that message out, and they'll be continuing to push that over the next few days. I think pulling together, as they haven't in the past, to make sure that their messaging is really centralised, that they're all saying the same thing. It'll be interesting to see whether or not there's any increase in security around the White House when it comes to mask wearing. There's already been some reports from reporters who've been at the White House today that they've seen more aides, more members of staff who work in the White House wearing masks. That's something that we perhaps haven't seen before. And of course, everyone will be watching very closely to see if there's any deterioration in the president's health. We're told that he's got mild symptoms at the moment, but of course he could worsen. So there will be intense speculation and intense demand for updates from the White House for all of us to find out exactly how the president is doing.
Sean, what do you think? More of the same or less of the same?
Well, it can't be more of the same, because he certainly can't be out at those super spreader events anymore with his adoring fans at campaign events. You know, this now becomes a virtual basement campaign. This is a president that has ridiculed Joe Biden for wearing a mask and for doing virtual events, which really has been a trademark of the Biden-Harris campaign. But what I would also look for is who else gets sick here, who else starts showing symptoms, right? There's a broad spectrum of contact tracing that is now just beginning, so we don't know the breadth of this. I can tell you what's already happened. Senator Mike Lee, a senator from Utah, Republican senator, who met this week with Judge Amy Coney Barrett, the Trump nominee to replace Ruth Bader Ginsburg on the Supreme Court. He has tested positive. He was at the White House earlier this week. He met with Coney Barrett on Tuesday. She apparently has also had a test and has come back negative. So he's self-quarantining for at least 10 days. The president of Notre Dame, where Judge Coney Barrett graduated from, he was at that White House ceremony where the president formally nominated Coney Barrett on Saturday. He has tested positive, and I can tell you he was seen at that event not wearing a mask, shaking hands, and this has now come full circle for him as well.
All right. Very quickly, Professor Mkolo, do you think that this will be a game changer, especially in the race for the vaccine, this development in the United States?
Yes, hopefully, lessons are going to be taken from this, and a lot of energy be brought into it to move everything that needs to move forward. Yeah, so we are really hopeful that, I mean, it takes some suffering sometimes to get certain responses, and hopefully there isn't a lot of suffering here, but then even without any suffering, that positive change will occur.
And just very quickly, Professor Kyang, we're looking at the list now of the people who are being contact traced because they were traveling with Hope Nix, the president's advisor. Could there ever be a situation, we spoke about the president being incapacitated, could there ever be a situation where a significant number of people are COVID-19 positive and elections have to be held back?
At this point, I think that would require, if that were to happen, it would lead to a significant legal challenge. And so I think that that's possible, but it's very difficult to figure out how that would play out. And I think that it would definitely be unforeseen. So it's difficult to base that on anything that's happened in the past. But really anything is possible these days.
All right. And so from a final question, does it change the multilateral landscape in terms of the negotiation skills of developing nations now, who now have an opportunity to say everybody is equal before COVID-19?
Leaders have emphasized this fact that no one is safe until all of us are safe. And I think it's a clear message to America that they will have to work with other countries. I mean, they will have to subscribe and respect multilateralism, but also commit to act with the entire world as they have established this important source of perhaps resource to ensure that we are able to move with speed to find solutions. We know that as long as we don't have a vaccine, no economy will recover. That must be clear to everyone around the world. As long as we don't have a vaccine, no one is safe. And therefore, leaders must work together. It was quite disappointing this week during the gathering of the United Nations General Assembly. I mean, the participation of the United States of America was very, very limited. I think Shawan can attest to that. But other countries were so committed. And my message to the continent in particular, and the South Africans in particular, let's continue to implement and respect the protocols around this pandemic. And let us listen to the World Health Organization. Let's wash our hands frequently. Ons moet ons hande was. Altyd. We must make sure that we wear the mask. Asigqoke ama mask lawa ukuthi nathi siphephe. Let's keep a distance. Hare hlompe milawu ena. Let us really comply with the protocols.
Well, in all the languages that you hope to hear. You can't say you missed the message. Sophie Mugwena, SABC foreign editor, thank you very much. Nick Copper, our colleague, correspondent in Washington, Shawan Bryce Pease, SABC correspondent at the UN, Professor Bully Makula, who's head of Department Internal Medicine at the University of KwaZulu-Natal, Professor Susan Kang at the University of New York as well. Thank you very much. The spotlight on the US president announcing that he's COVID-19, the wherewithal, what the fallout will and might not be. That's what you heard. We're taking a quick break.